Professor Baldwin and fellow classmates. My name is Tara Peterson, and I will be presenting today on melanoma. So what is melanoma? Simply put, melanoma is a type of skin cancer. In fact, the rarest form of skin cancer, affecting only 1 to 2% of people with that diagnosis. However, more specifically, it's cancer of the melanocytes, which are a specialized skin cell responsible for producing melanin, or skin pigmentation. Melanoma literally means black tumor, which is usually how it presents on the skin, as a black tumor or mole or spot. It is the most deadly form of skin cancer. The risk factors of melanoma include having a fair complexion that burns easily, having excessive UV exposure, either as sunburns as a child or tanning bed use or other unprotected skin exposure, having a large number of moles, having a family history of melanoma or other skin cancer, and being a man and of advanced age. So when do you worry about a mole? Thankfully, there are some warning signs that typically melanomas will exhibit. The main one is the ABCDE warning sign system. Suspicious spots will show one or more of these signs. A for asymmetry, B for uneven border, C for more than one color, D for diameter bigger than a pencil eraser, and E for evolution or any changes in a mole. In addition, the ugly duckling signs can be useful for people who have a lot of moles. If you have one mole that stands out as vastly different from the rest, it's probably worth getting examined. If any spots stand out, it's prudent to have them examined by a physician, specifically a dermatologist. If any spots are of concern, then they can perform a skin biopsy by either shaving a piece of the skin off or punching a piece out, and then it's sent to the lab for a pathologist to examine it for signs of melanoma. The severity or stage of the melanoma depends on several factors. The most important is the Breslow depth, which is how many millimeters down into the skin the tumor has grown. Related is the Clark's level, which is how many layers of skin are being affected. Ulceration is if the tumor has developed any open sores. Mitotic rate tells us how quickly the tumor is multiplying and growing. And finally, if any lymph nodes are involved, which would suggest a higher chance of metastasis. The treatment options are based upon the stage of cancer. In all cases, surgery will be performed in order to remove the melanoma. In addition, a margin of skin surrounding the melanoma is removed as well. This is done in order to ensure that no microscopic cells remain that could increase the risk of a recurrence. This does result in a large scar, however, as seen in the picture on the right. The surgery options are either a wide local excision, pictured above, or a Mohs surgery, which is usually done on thinner skinned areas such as the scalp and face. In addition, a sentinel lymph node biopsy may be performed in order to assess whether or not the lymph nodes have been involved. If they have, a lymphadenectomy is performed, which means removing all of the lymph nodes from the area affected by the melanoma. This is to help prevent metastasis. For advanced stages of cancer, immunotherapy and radiation may be considered. Chemotherapy is as well, however, it's not very effective on melanoma and isn't considered one of the main treatment options. When caught early, melanoma has an almost 100% survival rate after 5 years. In later stages, however, when the lymph nodes are involved or it has metastasized to distant sites in the body, the prognosis is quite poor. That's why early detection, frequent self-skin checks, and visits to the dermatologist are of vital importance. For more information, please visit the websites listed here. These were also my sources that I utilized in making this presentation, along with my own experience as a 2-year melanoma survivor. Melanoma is skin cancer, but it's not just skin cancer, so make sure that you take sun precaution and take your skin health seriously.